The next speaker is Dr. Sheetal Brar. She's a senior cataract and refractive surgeon. She was with us as a senior consultant at Netradama, and now she's practicing at in Brar Eye Hospital, Batinda, Punjab. Over to you, Dr. Sheetal.
Thank you, Dr. Supriya, and I would like to thank you and Dr. Sri Ganesh for again having me in this super hit course that he has been running now since the past 7 or 8 years. So it's an honor to be speaking in his course as always. So my topic today will be post-refractive surgery IOL power calculation, which was considered as a daunting task till few years ago, but nowadays because of the availability of a lot of online calculators, this seems to be not so difficult. So what are the 3 types of errors that can cause problems in IOL calculation post LASIK? It could be an instrument error, refractive index error, or the formula error. Instrument error essentially is when you use the keratometers for measurement of the corneal power, wherein they actually cannot correctly measure the corneal power post refractive surgery because the cornea has been modified, and they do not measure the central cornea, which has become flat now, and they measure the paracentral points at 3.2 mm zone, and so central data is extrapolated. So this is not very accurate, and this leads to an overestimation of corneal power and eventually a hyperopic shift. Refractive index error is again because most of the keratometers and topographers, they only measure anterior surface of the cornea, and then they convert this to the radius of curvature, which is measured to diopters using this formula, wherein the refractive index of cornea is assumed to be a fixed one, assuming the fixed relation of anterior and posterior curvature, which actually is not. So since they use this fixed refractive index of 1.337, which actually later was found as 1.334, and it can actually vary depending upon the ear and cornea interface and cornea and aqueous interface. So this also can lead to errors in IOL power calculation post LASIK. Now the third one is formula error. We all know that IOL calculation depends on effective lens position. Now following LASIK, the corneal curvature changes and ELP is wrongly estimated. So most of the third generation formula that we are using today will estimate the position of the lens more anteriorly, resulting in calculation of a lower powered IOL, and thus finally a hyperopic surprise. And 1 mm error in effective lens position can actually result into 1.5 diopter change in the final refraction. Now coming to different methods how to obtain true corneal power after refractive surgery, there are a lot of methods, and many of these are now obsolete. They are just of historical importance. So the formulae which earlier we were using were clinical history method, contact lens over refraction method, topography based formulae, central ring topography method, net corneal power method. So all of these were being used. For the want of time, I will not go into details of these formulae, but by and large now these formulae we are not really using. Topographic based formulae such as Koch and Wang formula and Sharma's formula are still being used in the ASCRS online calculator, and they are regression based formulae based on the LASIK data but not really suitable for post RK eyes. Central ring topography method is one of the methods that can accurately predict post RK the formula, the IOL power calculation in RK eyes. Now double K formula by Arambury is again one of the popular formula that actually uses the post-refractive surgery corneal power for calculation of the vergence or the IOL power, and the pre-operative surgery corneal power for ELP prediction. And for the current 3 generation formulae, it offers a kind of adjustment, and this can actually be done using this website drhill.com, wherein you can go and use the correction table for each of these formulae. So there are other formulas also. Hagee's L is a popular formula which is part of the inbuilt software in IOL Master 700 and 500 as well. So this is again a regression based formula based on the statistics of post LASIK eyes. The accuracy of this formula may actually decrease if the eye is on the edge. So it is quite popular formula, but for very highly myopic, hyperopic eyes, post LASIK it may not be very accurate, and also not accurate for post RK. Muscat formula is again a formula which is currently being used at some places, and it basically adjusts the power of the IOL using post-op measured data, and you have to have the knowledge of the surgically induced refractive change as well. Now our life is made much easier by the use of these, by the availability of these online IOL calculators, which are very easy, handy, and fairly predictable also. So there are various calculators which are available online on the ASCRS website, the post-LVC IOL calculator, the Hoffer program, as well as the Dr. Hill calculator on the Dr. Hill website. And this is a screenshot from the ASCRS website, wherein it's quite convenient to use. So you just need to enter the pre-op LASIK data if it is available. Even if it's not available, you can just put in all the ultrasound biometry data which is there in the lower part. And if you have a topographer, then it incorporates various topographers as well, such as TOMI, Galilei, ISIS, Atlas, and Pentacam. And you can use their specific values, and this can also, the topography based formulas can also be used. And once you have put in all the data which is available to you, it, depending upon what is available, it will automatically give you the IOL power which is feasible with the formulae which are incorporated in this. So this is again very popular, Barrett-Truquet formula. Most of us are using this because this is online, available free. And this is based on the Barrett Universal 2 formula that uses a modified keratometry value for post-refractive surgery eyes, and it also provides a double K solution when central Ks have been altered. Holiday EKR formula is again another formula which is quite accurate. And in this, you basically use the EKR values from the central 4.5 millimeter zone in the EKR map and use these K values in the Holiday 2 formula. Total keratometry, I will not go into details, Dr. Shreyas has already covered it, but essentially the swept source biometry and a combination of the telecentric keratometry, it basically measures the actual curvature of the anterior and posterior cornea, and it provides us the real values of the curvature of the anterior and posterior surface of the cornea, and thus it is now considered as most accurate out of all corneal measurements obtained through different methods. So these are some results with the Barrett-Truquet formula. And now we also have ray tracing formulae which are available in certain advanced equipment such as MS39, wherein the keratometry is quite accurate because it's ray tracing, and you just need to enter the axial length values, and it will give you the power calculation. So just discussing one case briefly. So this is a post-myopic smile patient who had come to Netradhama 4 or 5 years ago, and basically the patient's refraction was -6.5 and 5 in the right and the left eye respectively. He presented with the grade 2 cataract. So this is the topography of the right eye, and you can see there is still some amount of flattening which can be seen, and it is well centered. And if you look at the EKR map, you see it is not very regular. It's not a single peak. What you want to see here is a single peak that signifies a uniform distribution of keratometry. So since it was not a single peak, and when we also saw that the corneal abrasions were on the higher side, 0.65, and the Z4 was 0. So then we thought, why not use a negative aspheric lens such as Zeiss Lucia that actually can result in slight negative asphericity post-surgery. So the patient also achieved some amount of depth. So CT Lucia calculations were performed using different formulae, and you can see that we use the ray tracing method, the Hagees L, Holiday 2 with EKR, Barrett-Truquet, and Barrett-Truquet TK. So finally, you can see that the Barrett-Truquet and Truquet TK are very close, and also the Holiday 2 EKR. So this is what we went ahead with. And finally, what we saw at post-op 4 weeks, the correction was quite good. The spherical equivalent was within 0.25. So this is an excellent result for a post-LASIK case. So in conclusion, in post-refractive surgery, eyes use more than one method to measure central corneal power, use more than one formula, and it's always better to hedge in the direction of myopic results, especially if it's a myopic LASIK. And total keratometry based formulas, which are now being increasingly used, are give most accurate results, and patients should still be warned about potential need of refractive correction after cataract surgery. So pre-op counseling and chair time still remains the cornerstone of for success in these cases. Thank you so much for your attention.